Morning. My name is Paul Lauder.
And my name is David Horowitz, and we work at the National Practitioner Data Bank in the Policy and Disputes branch, where I'm a Senior Health Policy Analyst and Paul is a Management Analyst. If you need the slides for today's presentation, you can click in the download area at the top left of your screen. Be sure to click the name of the file first, Final Health Center, and then press the download button, and that will download a PDF file of today's slides if you'd like to have them to refer to later. Some of the questions we'll be answering in today's webinar are, what is the NPDB and why is it important to my organization and patients? When should I report and query? What is attestation? Why is it important and how do I do it? What resources exist to help me with attestation after this webinar? The National Practitioner Data Bank was created by Congress in 1990 as a workforce tool to assist organizations like yours to make informed credentialing, privileging, and licensing decisions. The primary purpose of the data bank is to protect the public from unfit healthcare practitioners, providers, and suppliers. The data bank is meant to serve as a flagging system for effective credential reviews and to deter fraud and abuse in the healthcare system. It is not meant to punish those who are reported or to be a stop sign that prevents practitioners from being employed. When you are considering hiring or credentialing a clinician, you would want to know what kind of information, if any, has been reported to the NPDB on them. We call that querying. When you query the NPDB, there is a lot of information available to your organization. To get an idea about how valuable the NPDB is as a workforce tool, here are some numbers. The NPDB contains over 1.3 million reports. Every month, the NPDB is queried over 640,000 times by healthcare entities across the nation. On average, state agencies, malpractice payers, and healthcare entities submit over 7,800 reports every month to the NPDB. There are over 670,000 practitioners and 24,261 organizations represented among the reports in the NPDB. This infographic shows the kinds of reports that are contained in the NPDB. The NPDB and health centers share the goal of providing quality care and ensuring patient safety. We understand your need as frontline providers for our most underserved populations to have access to tools and resources to engage and retain a quality health workforce. The NPDB is a workforce tool that health centers can use. As we noted in the previous slide, the NPDB is only as good as the information it contains. Therefore, reporting contributes to the completeness of the information in the NPDB, which adds value for all queryers who rely on the reports. Insufficient reporting denies health centers and other healthcare entities information on practitioners with real competency or conduct concerns. Healthcare entities that are registered with the NPDB to query are also required to report certain actions they take as part of their practitioner oversight with the goal of furthering quality healthcare. Clinical privileges actions, professional review actions, are actions that are based on a physician's or dentist's professional competence or professional conduct that adversely affect the clinical privileges of a physician or dentist and last for a period of more than 30 days. Acceptance of the surrender of clinical privileges or any restriction of such privileges by a physician or dentist while under investigation related to incompetence or improper professional conduct or in return for not conducting such investigation or proceeding. That is our definition of an investigation. If you privilege other healthcare practitioners besides physicians and dentists, you may report adverse clinical privileges actions lasting more than 30 days that are related to professional competence or conduct. But these healthcare practitioner categories are not required. Reporting on these categories of practitioners adds to the value of the data in the NPDB. And here we're referring to nurse practitioners, physician assistants, dental hygienists, etc., as some examples of personnel who are employed at community health centers. Although querying is required by health center program requirements, Policy Info Notices 2002-22 and 2001-16, health centers may query for all of the following reasons. When they have or may be entering into employment or affiliation relationships with healthcare practitioners, when practitioners apply for clinical privileges or medical staff appointments, when they are engaging in professional review activity with the practitioner, or when a practitioner asks for expanded or additional privileges, or when the health center is credentialing a practitioner or renewing a practitioner's credentials. When a health center queries the NPDB, it will get a lot of information. medical malpractice information, licensure actions by state boards, adverse actions taken against clinical privileges, and a lot more. But it is important to note that you may not get any information. 95+% of queries receiving no reports found response. This is also information that can be beneficial in your decision-making process. As you probably are aware, querying is not free. It costs your organization $2 to perform a one-time query and $2 to perform a continuous query. Self-queries cost $4. Note that self-querying for clinicians applying for positions or privileges at health centers is not an option for the health center. Clinicians are able to self-query at any time, but a practitioner self-query does not fulfill an entity's obligation to query. The entity itself is required to conduct the query. I note that someone is using the raise hand feature, and I forgot to announce that we're not using that feature during this webinar. If you have questions or something is not clear in the presentation, please be sure to type it into the Q&A box, include your name and email address, and we'll be happy to respond. Now we're going to talk about the attestation process. Attestation is a compliance initiative by the NPDB to ensure the most complete data on healthcare practitioners and entities is available for querying. Attestation has been in place for a number of years for state licensing boards, and the NPDB is now expanding it to other entities to enhance the quality of reporting. If your health center is responsible for making privileging and or credentialing decisions for other sites in your scope of projects, those sites will also be included in the attestation. As we mentioned in the earlier slides, many healthcare entities rely on the information provided by the NPDB to assist in the hiring, credentialing, privileging, and licensing process. Therefore, attestation has two goals: to ensure the accuracy and completeness of the information stored in the NPDB, and to help educate users about their reporting obligations. Most entities only occasionally report, so it can be difficult to remember all the ins and outs of reporting. Attestation is an opportunity for entities to look at their reporting requirements and make sure they understand what they are and whether they are meeting them. To give some background on attestation, back in 2010, the NPDB started a compliance effort with state licensing boards, which was very successful and has resulted in a large increase in the reporting compliance of these boards and the number of reports submitted to the NPDB. In the coming years, we are also rolling out attestation to medical malpractice payers, hospitals, and health plans. Attestation is linked to the registration renewal process, which occurs every 2 years. You will perform your attestation during the anniversary date for your registration. You will be notified when your renewal date is coming up. When you go into the IQRS system, which is our online system that you use to access the NPDB, you will see the information about attestation. As part of the attestation process, a person in the organization must attest that the organization is compliant with the NPDB requirements. This person must have access to all potentially reportable actions taken by the entity, determine if any of those actions were reportable according to NPDB regulations, attest to whether or not all reportable actions taken during the attestation timeframe were submitted to the NPDB, and can identify all site locations for which the organization makes decisions regarding credentialing and or privileging of healthcare practitioners. The data bank administrator may qualify as this person if he or she meets the above criteria. As an aside, the data bank administrator is responsible for maintaining the organization's NPDB profile and for creating and maintaining user accounts for all individuals in the organization who query or report to the NPDB. Organizations may have more than one data bank administrator. However, if the data bank administrator does not meet the above criteria, the data bank administrator must identify the attesting official, advise that person of his or her responsibilities, and submit the attestation on the official's behalf. When the data bank administrator and the person attesting are different, both of them will receive a confirmation email once the attestation form is submitted. During the demo, which we'll be doing next, we will explain a little bit more about this role and how to designate a person when it is someone different from the data bank administrator. I'm going to turn things over to Paul Lauderer now, who's going to conduct a live demo of the attestation process for us.
Great, thank you, David. So I'm going to be signing in to the IQRS system, which, as David mentioned, that's the system that everyone logs in to report and to query. And just hold on one second. Okay, here it goes. It's popped up. So this is the sign-in page, which I'm sure many people know. And you enter your entity's DB ID, plus your user ID, and your password. I'm going to be signing in right now. So I'm going to be going through the registration renewal process, which is tied to the attestation process. So every time you complete the registration renewal process, which is every 2 years, you'll be asked to do the attestation process. So for this live demo, I'm going to be showing you the, let me try this. All right, let's try that again. Sorry about that. Keep your fingers crossed. Oh, there goes, yay. Okay, so this is the entity registration confirmation page. This outlines your entity information. It also shows you when your registration renewal is due, which for this entity it's September 14th, 2017. And it also shows you what you need to do your registration renewal. So this information down here outlines exactly what you need before you start the renewal process. And one more thing too, since this webinar is primarily for attestation, I'm going to move fairly quickly through the registration renewal process. So if you have any questions about the registration renewal process, please contact us. We have a great help center, we have a fantastic website, and we are here to answer your questions. So for this page, this is the eligibility statutory authority for the NPDB. It contains all our applicable laws and regulations. So depending on which entity you are, some laws may apply to you, whereas others do not. But later on, I'll show you a little bit more, which outlines specifically which laws apply to you. And this screen verifies the users. So let me scroll down. So these users, right here, we have 2. These are the users that have current access to the IQRS system. So these are the people who should be logging in, they may be querying, they may be reporting, but ultimately they're the ones that have access. So on this page, if you see a user that currently doesn't have or doesn't need access because maybe they switched jobs, maybe they moved to a different health center, please delete them. It's important for the integrity of the system to make sure that only users that need access have access. So for us, these users, developer, they have no names, but they clearly need access for various reasons. So I'm going to keep them, and we're going to be advancing to the next slide. All right, and this slide is just asking to confirm that these users will remain active, and they will. So I'm going to advance to the next slide. This slide reviews the entity registration. And it gives you the opportunity to make sure that the name of the entity is correct, that the address is correct, and that various other information is correct. Now, here at the bottom, it has ownership of the entity. So for the vast majority of federally qualified health centers and lookalikes, so the majority of the people who are on the conference call, you will be considered a private sector organization. So the federal, state, and local government agencies designations are for public sector entities that are administratively part of the government agency. So that doesn't mean that, there are some different types of organizations out there, and we know you exist. And so we are currently drafting guidance that we're going to be putting up on our health center landing page in the near future. So when you are renewing your registration and you come to this question, if you have some issues about this private sector organization designation, please go to our website, go to the health center landing page, and we'll have additional guidance for you how to respond. And if after going to our website you still are confused, you can call our help center and they will also walk you through this step. All right, so I'm going to click continue. I'm going to be going on to the next page. Oh, so there's an issue with my address, and we pulled this information from the Postal Service, so we just want to verify that it matches exactly with what the Postal Service has. Great. So now we are at the eligibility statutory authority. So as I mentioned earlier, we gave you all of our laws and regulations at the very beginning. This page shows you which ones are optional and which ones are mandatory and which ones are not required. So in the case of the private sector organization, we have Title IV, and querying is optional, reporting is mandatory. And we ask here that you review this and make sure that it accurately describes your organization. So we're going to click yes. So here we're going to the entity primary and additional functions. So the primary functions for federally qualified health center and lookalike is health center, federally qualified health center, community health center. And I'm going to open it up and show you. There's quite a few, and it appears to be showing today. So you can see there's quite a few. You are going to be third from the top. And I'm going to hit continue to advance to the next slide. So I had mentioned earlier that querying is voluntary and reporting is mandatory. So I know many of you have deeming requirements that require you to query, but legally you would come up as optional for querying. However, since many of you are required to query for various reasons, you have to check this box that says allow users to query. So, and that allows the users that access the system under your entity's DBID to query on behalf of your entity. Now I'm going to click my box. I want my users, developer and developer, to query, and I'm going to be moving on to the next slide, the next screen. So right here we have, this is the point of contact for reports. So the point of contact, that's the person that the NPDB contacts if there is a problem with a report, or say if there's a dispute process, we'll contact that point of contact. So it's really important that you keep this information up to date. And you can update this information even outside the registration renewal process. And then there's the certifying official. And it could be the same person as the point of contact. In this case, it is not. So our certifying official is Peter Smith. And the certifying official certifies that everything that you include in this registration renewal process is accurate. So depending on how your health center is organized, it may be the same person, it may be somebody higher up. So I'm going to submit because I'm good, and this is the end of our registration renewal process. We're going to be moving on to the attestation process. So at this point, we're going to click the continue to the attestation button. So we're going to be moving on to attestation. So first, a lot of the things that David mentioned earlier about attestation, I'm going to repeat in here as we move along the slides, the screens, okay? And I think it's important to note that there's two goals of attestation. One, we want to educate users about their querying and reporting obligations to NPDB to ensure that you understand that the value in reporting, the value in querying, and if you have any questions about querying or reporting, you know where to go to ask. And additionally, we want to ensure that reporting entities are compliant with their legal obligations. So essentially, they're reporting what they're supposed to be reporting. So when you start the attestation process, you come into this introductory page. And this page provides a lot of information about attestation. So you'll include when your attestation is due. So August 15, 2017. We include a lot of links on the side, which you can access if you have questions about attestation, about reporting. Right here is the health center landing page. I'm not going to click on it because I'll have problems getting back into the system, but it's there for when it's time to attest. And we also include reports that your entity has submitted to the NPDB. So this line right here identifies all the reports that your entity has ever submitted to the NPDB. Whereas this line identifies the reports that your entity has submitted within the attestation timeframe. So the attestation timeframe is the previous 2 years from the date that you're attesting. So in this case, it's June 19th, 2015 to June 18th, 2017. And here it shows that the entity reported one clinical privileges action. So you can click on it, and it shows you what that action is. So you haven't even started. Like, this is just the introductory page. It's giving you a lot of information, which is great because before you start the attestation process, you can start preparing to attest. And so when it comes time to attest, we include what you need to attest. So this information down here. So that before you say, yes, I read that, I'm ready, I'm good, you can click, yes, I'm ready to attest now. But if you need to go back and you're like, oh, I want to verify some of the reports, you can go, no, I will submit my attestation later, and you can click this button right here. So I'm going to click, I'm ready to attest. So here's the page for the official who will be attesting on behalf of your organization. As David mentioned, in order to be the official who's attesting on behalf of the organization, that person must have access to any clinical privileges actions taken by the organization, determine whether or not any of those actions were reportable according to NPDB regulations, and attest as to whether or not reportable clinical privileges actions taken during the attestation timeframe were submitted to the NPDB. They also need to be able to identify all site locations for which the organization makes decisions regarding credentialing and or privileging healthcare practitioners. I'll get into that in the next slide, I believe. So here, if the person who can attest on behalf of the organization is the data bank administrator, you just click the box and it pre-populates the fields. If it's not, then you need to enter the information into the section. And it's very important, the data bank administrator has 3 tasks. First, they must identify the attesting official. Who can actually answer these questions? Second, advise that person of his or her responsibilities. And third, submit the attestation on the official's behalf. So I am the data bank administrator, and I can complete this attestation form. So I just click that button and I pre-populate the fields, and I'm going to move to the next step. So this screen outlines the service delivery sites. So as part of the attestation process, we need to make sure that we know which entity is responsible for submitting reports for a health center. Health centers are typically made up of many smaller service delivery sites and larger sites, and a larger central site. So if the central site is responsible for making all privileging and credentialing decisions for themselves and the smaller sites, then the central site is also responsible for all reporting to the NPDB. So this page allows your entity to confirm the organizational structure for your health center to ensure an accurate attestation. So these sites listed here are only service delivery sites that are part of your approved scope of project. The default answer is going to be yes. So I look down at downtown clinic, yes, midtown clinic, uptown clinic. So we credential and privilege for these people, these sites, and they're part of the project scope. So I'm good with that. But if you're not, say downtown clinic is no longer part of your scope of project. So you click no. And I'll show you in the next screen, or maybe in 2 screens, what you're going to need to do. So you're going to need to provide an explanation as part of when you say no. So say you look at these 3 service delivery sites and there's one missing. Well, you can click yes, and then you can enter that information here, and it will add that service delivery site to this selection. So at this point, I'm happy with all the service delivery sites, and I'm going to continue to the next step. So this is the attestation statement. So this is the important, really important page. It outlines the number of reports that your entity has submitted to the NPDB, the total reports ever, it's right here, and then the number of reports during the attestation period, so for the previous 2 years. As I showed earlier, you can click on the report that you submitted, and you can see. So at this point, you should have already reviewed, you should know, hey, we only submitted one report that was legally required, we're good to go. However, if you didn't, say you have 3 more reports to submit, this is a great opportunity. You can go down right here. You can say save and finish later. You go back, submit those reports to the NPDB, and then you come back to this page to complete your attestation. So this page also outlines your legal requirements for reporting to the NPDB, provides a lot of information about reporting and querying, and it includes the attestation statement. So you will attest that your organization's compliance with NPDB reporting requirements, including all sites for which your organization makes privileging and/or credentialing decisions. So if you're good with that, if you look at from June 19, 2015 to June 18, 2017, your organization submitted all their required reporting, you click yes. So now remember, so say you just renewed your registration renewal 2 months ago. You won't be required to attest until you renew again in 2 years. So this time period right here is going to change depending on when you are doing your registration renewal. So let's say at this point you say, no, I have some more things to report, more reports. We have a roadblock to tell you, hey, stop, you need to go back, report these reports to us, and then come back and report. But and we give you the option to save and exit out of attestation. However, if you still want to complete attestation, you can add a reason for the missing reports here, and you can provide an explanation. But as I'll explain in a little bit, once you complete your attestation process, we do not allow you to come back and change what you attest to. So it's important to report any missing reports at this point. So I don't know if you remembered, but I said that there's a missing service, a missing service delivery site, and so I said no. No, I said that one on the list is currently not available, or is currently not within my project scope. So in that case, you can explain why. Oh, this is not right here. Sorry. Okay. Sorry about that. So here it is. At this point, you have Downtown Clinic is no longer part of the project scope. So we ask that you please provide an explanation for why that service delivery site is no longer part of your project scope. So site closed in 2016. All right. So at this point, I'm good. We've attested everything, and I'm going to move forward. So I'm going to continue to the next step. Now this is the final page of the attestation, and we're just asking that you review everything to make sure that all the information is accurate. And you still have a chance to go back and correct it. So you can click Save and Finish Later if you have to report additional reports, or you can go up here and edit. You can click the pencil up here and then edit if you need to change anything that you previously entered information on. So I'm good with everything. I'm going to submit. And then you'll get a confirmation page. And so if the data bank administrator is different from the person attesting for your organization, both individuals will receive an email confirmation of this page. So at that point, that's the end of the attestation process. So right now we're going to switch back to the PowerPoint presentation. 1 second.
Before we continue, we have a couple of logistical housekeeping questions from the room, and I just wanted to go over again how we download slides, someone asked. Again, at the top left of your screen, you'll see a download pod. be sure to click the name of the file first, Final Health Center, and then press the download file button that lights up, and that will give you a PDF copy of the slides that we're using in today's presentation. Someone noted that they're having trouble hearing, that there's an echo on the line. We recommend that you not use your computer speakers and the Adobe Room audio. We recommend instead that you dial in on the phone line. The phone dial-in information was contained in the confirmation email that you should have received before the call began. There's a toll-free line, and that's the best way to get the audio in the room. We had a couple other folks raising their hand. Again, let me remind you, we're not using the raise hand function during today's webinar, so please submit any questions that you have in the Q&A box, which you'll see on the left-hand side of your screen. So just to review a couple resources that we have for you, we have our website, which is www.npdb.hrsa.gov. We have the Health Center landing page at that address, and that contains all the information that health centers will need to understand the attestation process and get some of their questions answered, and we'll be adding to the content on that page as we go forward. There's a help center for the entire NPDB, and any questions that you may have about policy can be sent to us at npdbpolicy@hrsa.gov. Our customer service center at 1-800-767-6732. That's 1-800, and it's spelled SOS, NPDB. I'll repeat the number, 1-800-767-6732 is our customer service center, and any technical questions relating to billing or registration can be directed to that center. We're going to do a few Q&As that we have for you, and then we will take questions from the audience that have been submitted. First, we'll start with a few questions that we have created for you. The first is the data bank administrator the same person who attests for my health center? The answer to that question is it depends. The data bank administrator may or may not attest for an organization. The person who attests needs to meet all the following criteria. They need to have access to all potentially reportable actions taken by the entity, determine if any of those actions were reportable according to NPDB regulations, attest to whether or not all reportable actions taken during the attestation timeframe were submitted to the NPDB, and identify all site locations for which the organization makes decisions regarding credentialing and privileging. If the administrator does not meet the qualifications for the attesting official, the certifying official might meet those qualifications.
During the attestation process, I discovered there is a reportable action from 5 years ago that was never reported to the NPDB. Could I still report the action? Yes. Even though it has been 5 years, the action should be reported to the NPDB.
Question 3.
Sorry.
Oops, sorry about that. During the attestation process, I identified 3 actions that need to be reported to the NPDB. What should I do? Before you complete the attestation form, we ask that you submit the 3 reportable actions to the NPDB. After you submit the reportable actions, you can log back into IQRS and click Yes on the attestation form, attesting that you had submitted all the required reports.
I am the data bank administrator, and I recently completed my renewal for my health center before the attestation process began. When will I be required to complete the attestation process? The attestation process is tied to the registration renewal process, which occurs every 2 years. Since you just completed the registration renewal process, your health center will not be required to attest until it goes through the registration renewal process again in 2 years.
Question 5. There are 25 sites within my health center's scope of project. Does my health center have to attest for all of those sites? The answer is yes. If your health center is responsible for making privileging and or credentialing decisions for those 25 sites within your scope of project, those sites are included in your attestation.
I use an agent for my querying and reporting to the NPDB. How does that affect this process of attestation? You will complete the attestation for your health center regardless of whether or not you use an agent. If you discover that the agent has not reported all the required reports to the NPDB, it is your health center's responsibility to make sure that those reports are submitted?
Question 7. I answered no on the attestation form, indicating that my health center has not submitted all the required reports to the NPDB. After the reports are correctly submitted, can I go back and change my response to a yes? When you click no on the attestation form, you are given the option to submit the required reports before submitting the attestation form to the NPDB. However, once you have submitted the attestation form to the NPDB, you cannot go back and change your response. It is a final process. Therefore, we ask that you submit all the required reports to the NPDB before submitting your attestation form.
Can I ask a physician who is applying for a position in my organization to submit a self-query report from the NPDB instead of doing the querying myself? No. The health center is required to do the querying itself, and it must be registered with the NPDB.
I use an agent to receive query responses. Do I still need to register with the NPDB? Yes. In order to receive query responses, even from an agent, you must be registered with the NPDB. So I'm going to display our contact information again. That's the number for our administrative office. And again, the customer service center number is 1-800-767-6732, 1-800-SOS-NPDB for any questions concerning technical matters with the system, billing, and registration. If you have policy questions, please email us at that address, npdbpolicy@hrsa.gov. We'd like to thank you for participating in today's webinar. We know that attestation has taken time and effort, but it will pay off in better healthcare for community centers and the healthcare community as a whole. Reporting to the NPDB contributes greatly to quality healthcare and patient safety. By reporting, community health centers can provide needed information to NPDB queryers who want to make sure their quality of care is the highest possible. The NPDB exists to offer complete, accurate, and timely information. It is a valuable workforce tool for health centers and other healthcare entities. With reporting, we do ask that you consider the value of NPDB reports in hiring and credentialing decisions. Knowing a practitioner has a report in the NPDB does not mean that he or she isn't qualified, but it does provide additional information to guide your entity in making the best decisions. We've put up a short survey of 3 questions that we'd like you to answer for us that'll help us plan future webinars and to learn a little bit more about our audience. Again, thank you for your time today, and we'll leave the survey up until everybody's had a chance to make responses. Thanks again for your time.
Thank you.